Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and founder of the website betterhealthwhileaging.net. And this is the Better Health While Aging video podcast, where we discuss common health problems that affect people over age 60 and the best ways to prevent and manage those problems. Today's episode is part of a series that I'm doing on age-related hearing loss, and I'm delighted to have a special guest back here today. My guest is audiologist Dr. Cliff Olson. He is the founder of the Applied Hearing Solutions Clinic and also has a well-established YouTube channel, Dr. Cliff AUD, where he covers all things related to hearing loss and audiology. Now, I recently did an episode with Dr. Cliff asking him if he'd be willing to explain hearing loss treatment options such as hearing aids. And so if you haven't seen that, please go take a look. It's really, really great what he taught all of us about getting hearing loss treated. But also, when we first had our initial chat, he mentioned that, of course, it's always important to make sure that earwax has been addressed first. And I said, yes, because this is something that we often focus on in geriatrics. We are always looking in our older patients' ears because so many of them seem to be having some hearing difficulty, and we are often finding quite a lot of earwax there. So I thought it would be fun for us to do an episode specifically about earwax and how to remove it, since Dr. Cliff does have experience with this as well. So Dr. Cliff Olson, you are an audiologist. How often does earwax show up in your work helping older adults with their hearing issues?
Yeah, more than I would like to admit, but kind of like a physician would, almost the first thing that we do with a patient when they come in the office is we take out our otoscope, we look inside their ears, and we see what we're working with from an earwax standpoint. And, to be honest with you, everybody produces earwax, some definitely more than others. Genetics has a huge play with it, but I feel like in a given week, I'm doing probably around 20 to 50 rounds of earwax removal on my patients.
Oh, wow. Okay. So you are a pro. I'm often seeing it, but not actually the one they're trying to extract it. Well, let's start with the basics. Like, what exactly is earwax? Do we actually accumulate more of it as we get older, and how does it affect hearing?
Yeah, so earwax is actually a combination of three different things. You have ceruminous waxy secretions from the ceruminous glands inside of the ear canal. You have dead skin cells, and you have hair. Now, I'm not talking like the hair from a haircut off of your head, but inside of your ear canals, you do have hair in there, and eventually that hair falls out. And what happens is all three of these things kind of combine into what we know as earwax. And so if you've ever had earwax pulled out of your ears and you look at it, you're like, oh, that's super gross, because what you see is it usually turns dark when it gets drier, and you see all these little hairs poking out of it, and it's dead skin kind of all kind of intertwined inside of this ball of wax. And honestly, I'm desensitized to it at this point, but a lot of patients critique like, oh my gosh, that's the grossest thing I've ever seen in my life.
Yeah. Well, I mean, I would say, so far in life, many of us have had the experience with like a little Q-tip, although I know, Q-tips are often not recommended. You're supposed to be careful, but, if people wipe a little bit, you see a kind of often yellow or orangey sort of schmutzy stuff on there. But of course, when we find patients who have their significant earwax, it looks more than like a little schmutz on the canal. So what is it that makes it so common as people get older to have like really significant blockages?
Yeah, these secretions do increase over time, and oftentimes it's also just neglect of it, not really paying attention to how much earwax that you're producing. Like I mentioned earlier, there's actually a genetic tie-in with this. So if there's certain genes that will make you an excessive earwax producer, and then on top of that, the size and shape of your ear canal can either allow that earwax to naturally migrate out of your ears to where you can easily get it with a Q-tip at the opening of your ear canal or wash it out in the shower. But for other individuals, it almost creates like the bends in your ear canal will create a pocket where it does not allow that earwax to escape to the point where you would even try to get it out with a Q-tip. I mean, there's people who will try to wipe out the openings of their ear canals with a cloth or with a cotton swab like you mentioned, and they're like, oh, I didn't even have any earwax come out on that. But the earwax can be further in the canal, trapped, and it creates a big ball of wax that will eventually close off your ear canal and give you a hearing loss.
Right. So broadly speaking, it tends to interfere with hearing, right? Especially, I guess, if the canal is completely plugged up.
That's correct. Now, so a lot of people think, well, if I have a lot of earwax in my ears, I'm going to have a hearing loss. And that's not necessarily true. It has to completely occlude the ear canal. So it has to block off the ear canal 100%. And until it does, you will have your whatever your normal level of hearing is. Now, if you have a hearing loss for other reasons, go check out the last episode to see what those are about. But if you have a hearing loss, you'll have whatever that hearing loss is. But as soon as earwax creates a full seal of your ear canal, it gives you a 30 decibel drop. Now, that is a massive drop, and it's across every frequency of your hearing range. And so if you were to just literally take your fingers and plug your ears, that is the equivalent of what you would get if you had a complete earwax impaction inside of your ear canal.
Mm-hmm. So great for noise protection if you're at, a rock concert or if they're jackhammering. But if you are older and maybe already experiencing some of that age-related hearing loss, that can, really significantly make things worse.
Oh, yeah. It definitely compounds the impact of that. If you have an underlying hearing loss already, like presbycusis, age-related hearing loss, again, you're adding another 30 decibels of hearing loss to the existing hearing loss. So they compound on each other. So if you're someone with a moderately severe level hearing loss in low, mid, and high frequencies, all of a sudden you have a profound level hearing loss in your ear that there's no way you're going to hear anything, even if you put your hearing aid back in your ear.
Right. Okay, so definitely an issue, definitely important to check. And I don't know that this is something people can easily check at home, but any primary care office should be able to take a look and at least tell you if it's significantly blocked. Your hearing care professional can tell you as well. And so now let's talk about options for getting it out once we realize that it's there and we need it out. Can you please talk to us about options and also about how to keep this a safe process?
Yes, safety is the key when it comes to this, because if not to freak anyone out here, but if you make the wrong move at trying to self-remove earwax, you can rupture your eardrum. The eardrum is 3 layers of epithelial tissue. It does not take a lot to rupture your eardrum if you were to, say, go in too far with the Q-tip or go in too far with a bobby pin, like a lot of people do, that they shouldn't do. But so first and foremost, safety is the key for this. But if you were to break it down into, okay, what are the things that you can do? Well, there are things that you can do at home, and there's also the professional removal, and there's a variety of different ways to professionally remove earwax. So let's kind of start with the at-home stuff, okay? One thing that I typically recommend, and I even recommend this to my father, who has earwax issues in only his right ear for some reason. But I first professionally removed earwax from his ear, but after that, he lives in Illinois. I live in Arizona. So he's not going to be able to come in to see me every 6 months to clean out his ear. So I told him to just in the shower, let the shower water flush out your ears. Every time you take a shower, you let the shower water flush out your ears. As long as you're someone who does not have a history of a perforated eardrum, then you can safely do that typically. Most water pressure is regulated in most states, so you're not going to have like an elephant, pressure shower head to blast out your eardrum from doing that. So that's typically what I'll recommend. And then you take a Q-tip afterwards, not that you're going and digging around for earwax, you're just drying out the opening of your ear canal. Okay, so that's one of the easiest, most cost-effective ways to try to keep earwax under control and get some earwax out of your ears. The next best way is to use some form of an over-the-counter product, like an eardrop, and then after you put the eardrop in your ears, you flush out the ears with like a bulb syringe or something like that. Now, there's different products that are available on the market, but the most common products are the ones that have carbamide peroxide in them. And this is great because it helps break down the earwax. The problem is a lot of these products out there have an oil base. And anytime you put a carbamide peroxide inside of an oil base, and I won't share names here, but the most popular earwax removal product in terms of purchasing has an oil base. And if you were to actually do it,
I'll share the name. I think it's Debrox, right?
Hey, there you go.
There you go.
And so if you put some of that Debrox inside of a container with some of your earwax in it that you had extracted from your ear, you could come back a day later and that earwax would not have changed at all. It would still be in its solid form state. There are other products out there that have water base to the carbamide peroxide. When you put earwax inside of that, within 10 minutes, that earwax is almost completely broken down. So you want to make sure that you're using a viable product. One of the ones, I actually use this in clinic, but it's Earwax MD is the best one, and I've tested everything. Earwax MD is the best one that I've found. Is there a better one that another product that's out there that's better than Earwax MD? Perhaps I just haven't found it yet. Okay.
Okay. And so for that, people put in some drops, and then do they do it over a few days, and then that gives it enough chance to soften up and come out? Or can they do it and an hour later try to get it out?
Yeah, oftentimes I would say just follow the instructions that they have in the container. Most of them will say put it in your ears for about 10 to 15 minutes. Flush it out. If you need to reapply a couple times in the same session, go ahead and do that. There are instances where I'll have a patient come in who has a really bad impaction, meaning it's been in there for probably years and it's super hard and dry. I might have them go home with some Earwax MD and soften their earwax before they come back in for professional removal to make that experience a bit more pleasant.
Yeah. Okay. All right. So you said option number one, rinsing with the shower, but that's really to keep it from accumulating.
Yeah,
it sounds like.
It doesn't do
Not
a
so
great
much
job
if
of
you've got,
removal.
like,
Yeah,
a
if
lot
you
of
want
it.
to actually break it down and remove it, you're probably going to have to apply a drop to break it down before you flush. And you can still flush in the shower and still have success with that. If you feel like it makes your hearing worse when you do it, or you feel like the problem is worse, it could be worse. Remember, it turns the earwax into like a gelatinous material, like a gelatinous type of wax, and that can actually cause more problems potentially than the dry wax that was inside of your ear. So you got to be careful with that. For more tech-savvy individuals, they do sell on Amazon for like 20 to 30 bucks an endoscope that you can connect to your smartphone, look inside your own ear to see if you have earwax. If you want to know what a normal ear canal looks like, just Google what a normal ear canal and eardrum looks like, because you might not recognize wax when you first see it if you've never looked for it before.
Or maybe now the AI will tell you.
Perhaps the AI will tell you for sure.
That'll be
take a photo
the
of that and upload it
frontier.
to ChatGPT, right?
Okay.
But you could do that. And so those are all kind of like the let me try to handle this. Notice how I did not say go in and fish around with the tool that you bought online to try to dig the earwax out. You can cause abrasions in your ear canal that can cause ear infections. Of course, you can rupture your eardrum, which is a huge problem. And then also you can just be extremely unsuccessful at doing it and push the wax in further into your ear. And now you have to go to that second option, which is professional removal.
Yeah. And now take us through like what professional removal looks like.
So professional removal, I will say this is probably the most fun thing that I do inside of the clinic is removing earwax. For some reason, people watch the Dr. Pimple Popper and they're like, oh my gosh, this is so fun. It kind of is fun to do.
Do you have videos of this on your channel for people who want to go that route?
I do. So I tend to stay away from that. There are other great YouTube channels out there who do a ton of earwax removal content. So if you're into that kind of thing, knock yourself out. You can find it pretty easily. But it starts off when you come in. Usually we're asking you a variety of questions beforehand, and we'll eventually, whether we think you do or do not have earwax, we'll look inside of your ears. If we see it, if we're like, oh, there's enough earwax here that we need to remove this earwax, we will then put our video otoscope inside of your ears to bring it up on the big screen so you can see what we see and so we can point everything out. And we like to do that because we also like to do an after image of the ear canal to show like, look, we've removed all your earwax. You can see your eardrum. Everything looks normal in there. But to go from an impacted ear canal to a clean ear canal, it can be a process. And so the easiest method to remove earwax is with a curette. So usually a little metal curette. We open up your ear canal with a speculum, just a little metal speculum, just to straighten out the ear canal. And then we have essentially a pair of Vorotech O-scope glasses that converge our vision into a single field of vision looking in the ear canal. So we have depth perception. If we don't have depth perception, we don't know how far our tool is inside of your ear canal. So we have to have that convergence to safely do it. This is kind of why you don't want to go to someone who doesn't specialize in earwax removal and have them do the wax removal. You want to go to someone who's definitely comfortable with doing it, okay? But then we'll just go and we'll pick out the earwax. And once we kind of pick out all the earwax, we'll usually go in with a cotton swab with a little rubbing alcohol and just kind of tidy up any residual earwax that's left behind. And then we take a post image and we have a pristine ear canal to work with. Well, in some stubborn cases, we might have like a wet, goopy earwax. In those cases, we can break out microsuction. And so we can actually go in and suction out the earwax from the ear canal if it has a wetter consistency. You want to be careful with this as well, because again, you don't want to take that suction tip and go too far into the ear canal. It can make a really loud sound, and we don't want to give people some noise-induced hearing loss or tinnitus when we're doing this. So again, someone who knows what they're doing with it can safely do it. And if we need to break out the big boy, what we do is we bring out the irrigator. So the irrigator, it's kind of like a funny pun name, right? So we actually irrigate the ear canal with body temperature water. That's a very important distinction here. My grandmother went into a clinic that you would assume would be really good at removing earwax because they specialize in ears specifically, and they had someone basically try to flush out her ear canal with cold water. And if you know anything about how the vestibular system works, if you put cold water into one ear, it will create this convection effect of the fluid in the inner ear, and it will make you dizzy. And potentially so dizzy that you get nauseous, and that's not a good thing, of course. So you want to make sure that the ear canal is being flushed out with body temperature water so it does not create a convection effect, and then you can safely blast the earwax out of the ear safely. As long as you don't have history of eardrum perforation, you can safely do that method. But those are the typical methods that we will do professionally inside of the clinic, and either a combination of them or one of them will 100% get that earwax out of the ears.
Great. Okay. And then just since we have been talking about, hearing aids, especially in the previous episode, how does the earwax affect hearing aids? And what should people do to make sure that their hearing aids aren't being affected by earwax?
Right. And to go back to something that you said earlier, which is like you see earwax in the ear canal, and if it's not blocking off the ear canal, it's like we don't really have to remove it because it's not negatively impacting hearing. And to be truthful here, some earwax inside of your ear canal is healthy. It's antimicrobial. It creates some protection inside of the ear canal. The problem with earwax when it comes to hearing aids is that earwax loves to work its way into the tip of the hearing aid and completely block off the sound. And so that's why when we have patients come in, no matter what, if they report that they have earwax issues or not, we're going to clean out their ear canals, even if they have residual amounts of it building up in certain spots. We'll go ahead and proactively pull that out so it doesn't lead to further issues down the road. But if someone does have a lot of earwax-related issues, hearing aids are actually pretty well equipped to handle earwax issues. There's a couple ways that it does this. Number one is that you have what we call wax traps that go onto the tips of the hearing aids. They are designed to trap wax. Sound can make it through, but wax cannot make it through. And so anytime it gets filled up with earwax, you have a little toolkit that you go and you remove the old wax trap, you pop in a new one, everything's good to go again. There's a hearing aid manufacturer that will create rubber domes for your hearing aids that when you attach the rubber dome onto the speaker or receiver of the hearing aid, it's a sound permeable membrane, so no earwax can get through, but sound can still get out, and it kind of sheds the earwax off to the side of the dome. So there's definitely ways to circumvent those earwax-related issues from blocking sound. And I'll also throw in another little piece of advice here. A lot of individuals who have custom ear molds on their hearing aids, they also have vents that run through to equalize the pressure of the ear canal, as well as allow some sounds to enter and leave naturally. And if those vents get plugged up with earwax, it can give you the occlusion effect, which makes your own voice really boomy and loud to yourself, and nobody likes that. So you have to run a vent cleaner through the vent of the ear mold to make sure that wax is not causing an issue with that.
Okay. All right. Well, Dr. Cliff, thank you so much. It sounds like, especially if you know you're prone to earwax and you're getting hearing aids, your hearing care professional should be able to talk to you about the features you have, how you check your hearing aids and make sure they're not being affected by wax, and they should be able to help you out if you're having issues.
For
Does
sure.
that sound right?
Absolutely.
All right. Okay. Great. Well, thank you so much, Dr. Cliff. And where can people find you to find out more about Earwax or anything else hearing?
Oh man, well, you can check out my YouTube channel, Dr. Cliff AUD. There's a couple thousand videos on there, so you'd have to sift through and run a search for the videos that you want to find. And if you're particularly interested in earwax, do searches for earwax there. I have a ton of information on that. And if you are somewhere in the United States or Canada and you're looking for a hearing care professional who knows what they're doing when it comes to earwax removal, you can always check out my hearingup.com website. You can find a hearing care professional who does earwax removal there as well.
Okay. Thank you so much.
Thanks.
And with that, thank you so much for watching. If you found this helpful, you're here on YouTube, please go ahead and subscribe. It does help more people find the channel. If you've been listening to the audio version on the podcast feed, come take a look at the video if you get a chance. You'll see my key points on the screen. And again, if you want to support my work, it's always an option to join as a member of the Better Health While Aging YouTube channel as well. So thank you once again. I look forward to seeing you all soon on a future episode of the Better Health While Aging video podcast.